Welcome back to Your Child is Normal. I'm your host, Dr. Jessica Hochman, and today we're continuing my conversation with Dr. Nina Shapiro, pediatric ENT and author of Take a Deep Breath, Clear the Air for the Health of Your Child. In part 1 last week, we talked about baby breathing, what's normal, what's not, and how to help little ones breathe easier. In part 2 today, we're shifting our focus to older kids. Dr. Shapiro breaks down the most common causes of chronic nasal stuffiness, when to consider allergies or sinus issues, and how to help our kids get better sleep and breathe comfortably without overusing medications or antibiotics. You'll also hear a lot of great practical advice. For example, Dr. Shapiro will teach you how to teach your kids to blow their noses, and she also explains how to know when congestion might be a sign of something more. If you haven't already, please take a moment to follow and leave a 5-star review for Your Child is Normal. It really helps other people discover this podcast and supports our growing community. Now let's jump into part 2 of my conversation with Dr. Nina Shapiro. So now I would love to transition to talking about older kids and breathing concerns. One of the most common concerns I hear from parents about their kids and breathing is about a kid who is always seeming stuffy. Can you talk about this? What are the common reasons why kids have chronic congestion?
Chronic nasal stuffiness is something that's really common in kids. Parents are very aware of it. Kids certainly don't care typically. Sometimes there's some fluctuation in it where they're always a little stuffy and then sometimes they're really stuffy. But then even when they're not really stuffy, they're a little stuffy all the time. And so my job, and yours as well, is to figure out what it's from. Is there something that is quote unquote fixable or something to address that we can take care of this? Because again, kids are not obligate nasal breathers. They can breathe through their mouth just fine, but the function of the nose is to breathe through. So it filters the dust, it filters the air, it humidifies the air that we breathe. So ideally, we should be nasal breathers. Why do kids have stuffy noses? It could be just these low-grade colds that kids are getting in daycare and preschool and elementary school, and then they just always have a little bit of a low-grade congestion because they're always getting these viruses and they come and go and there's a little bit of fluctuation. That's just something they need to grow out of. We can go back to nasal saline is still the greatest stuff for older kids too, and if you started it when they were newborns and infants, they'll probably tolerate it a lot better. So nasal saline is a great way to treat that and sort of minimize it.
I agree. I think the number one reason why kids are seemingly chronically congested is because of all of these back-to-back colds, especially in the preschool years. Kids on average have 6 to 8 colds, especially during the fall and winter months.
Right.
So that's 1 cold a month easily. And some kids have more than the average. They may have siblings at home.
Yes.
They may be exposed to more. So it can seem like they're always congested.
And they are. And sometimes it's the start of the cold and the cold itself and getting over the cold. And by the time they're just about to get over it, they get another one. So that's just something that's uncomfortable, certainly nothing to worry about.
It's frustrating and it's so hard.
Yeah. But I try to minimize any sort of medications for that unless the symptoms are absolutely intolerable. I think just nasal saline, again, I'm not a big fan of cold medicine or even allergy medicine if it's not allergies. I think, less is more when it comes to that. But another possible reason that a child can be stuffy all the time, it could be allergies, could be indoor allergies, could be outdoor allergies. Less commonly food allergies. A lot of parents will ask about, are they stuffy because they're having a certain food? The food allergies don't typically cause that kind of congestion. But I think if it is a child who's not sick and they're stuffy all the time, and certainly if they have other signs like it's a clear runny nose, kind of like a watery runny nose, if they also have like itchy eyes or a history of eczema, then it's very reasonable to look into whether there's an allergy or allergies that are triggering that, and that could be addressed.
Okay, so to ask you a little bit more about this, environmental allergies you mentioned as a possibility, but we typically don't see those in the first couple of years of life.
Right.
It takes some time for the body to develop these allergies. So I think that's an important tidbit of knowledge for parents to be aware of, because oftentimes we have kids that are being treated with antihistamines, that they're making an assumption that it's allergies. Maybe the parents have allergies, and it's not expected in the first couple of years of life.
Right. And if you do any allergy testing, aside for food allergies, if there's a clear food sensitivity, the testing is not going to be very accurate under age 4 or 5.
Are you opposed to families trying to give their kid an antihistamine to see if it's helpful?
No, I think it's reasonable to try, but I like to know what they're treating. If an antihistamine helps, then sure. But again, just to assume that, oh, they have allergies and they're 3 years old and they're taking an antihistamine once or twice a day, every day, I don't know. I feel like, well,
Why give a medication unless it's necessary?
Exactly.
Absolutely. I agree. I'm not opposed to a kid trying it. If it's
Yeah.
helpful, fantastic. But if it's not, be aware so that you don't treat with a medication unnecessarily. The other thing with nasal allergies is I find kids are really itchy. They're always rubbing their noses, they're always rubbing their eyes. So that's a sign to be aware of as well.
Right. And they get a line sometimes in the middle of the bridge of their nose called the allergic salute from rubbing their nose all the time. So that's also sometimes an allergic sign. Another medication, if it's a child who's just really congested all the time, and it seems a little potentially scarier than antihistamines, but it's actually very safe, nasal steroids. To use a topical nasal spray. They're all safe for ages 2 years and up. And one spray once a day. It's an anti-inflammatory. It's not really absorbed into the bloodstream in that way. Even if the child doesn't have allergies, because it's just an anti-inflammatory and not specific towards allergies, it can help a lot. And those kids are a lot more comfortable.
I agree. I do see symptom improvement with nasal steroids when used properly.
Yes.
I'm curious, do you have a preference for a brand? I find certain brands may lead to more side effects because of the alcohol in it. So I'm curious, what is your preference?
So the one that I have found, and has changed over the years, it used to be Nasonex. It's a little harder to get. Now I like to use Flonase Sensimist, which is the really milder form of Flonase. Flonase itself, it stings a little bit. A lot of patients don't like it. Has a funny smell that a lot of patients complain about. And one of the side effects that we see a lot is nosebleeds. Sensimist, it's indicated for ages 2 years old to 12 years old. I even recommend it for older teenagers. It's just better tolerated. It has almost no smell, no taste, doesn't sting, doesn't cause nosebleeds, very safe to use long term. So that's usually what I recommend.
I remember once I asked you about a child who had some hearing loss after some colds,
Yeah.
and you said, try some Sensimist.
Yeah.
It was a great recommendation. It was helpful, so thank you. Okay, now I love that you brought up how food allergies are not a common cause of chronic congestion.
Right.
This comes up all the time with dairy and milk. I have parents that have sworn that they cut out milk and their child's congestion got better. So I don't want to poo-poo it. I don't want to say that that didn't actually happen. But in your experience, does that improve the symptoms of chronic congestion?
I don't think so. And I hear that as well. I think a lot of parents who are saying that are giving milk to their child, or certainly when it's a baby, right before bed. And even like a bottle of milk in the bed. And then certainly if you cut that out, everything is going to get better, including their teeth and their reflux. So I think dairy is great. I think milk is really important unless there is a true allergy. I'm not a big fan of milk substitutes unless you have to have those milk substitutes. I think the sugar content is way too high and a whole list of problems. So I'm a big fan of milk and dairy if you can tolerate it. And most humans can tolerate it very well. I think a lot of it just has to do with timing. And just as we don't drink a bottle of milk and then lie down and go to sleep, certainly a child shouldn't be doing that. And it's going to cause other issues, including congestion, if they have milk too close to lying down. So I think that's really the main issue.
Yeah, I think a lot of people believe that milk increases the amount of mucus that you produce. And so I like what you wrote in your book, that it's probably more of the sugar content that's making the milk a little more sticky.
Yes. And frankly, and I get this question a lot after tonsillectomy, can my child have dairy? Sure. Actually, there have been studies that found that ice cream actually reduces post-tonsillectomy pain. So more than popsicle. And I think
I love that.
is that it coats the back of the throat a little bit. But that never hurt anybody. It's not going to make you sick. It's not going to give you more mucus in and of itself. There may be a little bit of film back there, and it usually goes away in about 10 minutes. And that's fine. It's not going to make them sick or congested or have any problems. Just don't do it lying down. Just like adults don't eat lying down, or we shouldn't. And so neither should babies.
That's a good point. Just keep them upright for 5-10 minutes and they'll
Their
see an
esophagus
improvement.
is long and their stomach is big.
There's not a large distance to travel. If you have a good amount of milk, you lie down, it's going to come up and make it into the nose. I get a lot of parents that are always startled that their kids can sneeze milk out of the nose.
And it gets to their ears too. Think of that too.
Now, the other question I have that comes up is parents get frustrated that their kids refuse to blow their noses.
Yeah.
Do you happen to have any tricks to encourage kids to blow their nose?
Yes. So blowing your nose, especially when you're a child and you're learning, and you're stuffy. It's very scary. It feels like it's going to pop your ears. It feels like it's going to hurt your brain. You just don't really understand. And it's a scary concept. And why am I going to do this? It's going to cause something going on in my head. So I recommend in that those small windows of when your child is well and they don't have a stuffy nose at all, and there's no congestion and no mucus, that's the time to teach them how to blow their nose when there's nothing there. Because then they don't feel that fear of everything's going to backflow and cause this pain and pressure. So you can make, depending on your child, you can make it into a game. You can have them close one nostril and blow a little toy across the table, or blow a tissue and put it in front of them, see that they can move it back and forth. But I recommend teaching them how to nose blow and clear their nose when their nose is clear. And then they'll be less afraid for when it's stuffy. That's my trick to do it.
I like that. I like the tissue trick. Put it in front of the nose and see it move back and forth.
Yeah, and they can, one nostril does it and then the other nostril, or both at the same time. Make it into a little game. But again, it's best to do it when they're well.
That makes sense. To catch them when they're not in a state of feeling nervous or unhappy. Yeah. Absolutely. Okay, now the big question I get a lot from parents is antibiotics. When do you find that antibiotics are beneficial to a kid who's having weeks and weeks of congestion? Is it worth giving it a try? What are the signs and symptoms when you find it will actually make an improvement in their symptoms?
So specifically for nasal symptoms, I think antibiotics have very little benefit, frankly. I think it really has to be something prolonged, meaning a week or two of chronic, dark nasal discharge, fever, cough, headache, and that's a sinus infection. Everything else is a viral infection and a cold, pretty much. A lot of parents talk about fever being a sign of a bacterial infection. You can get really high fevers with viruses. We all know that now. And I think a lot of it has to do with, a lot of parents talk about the color of the runny nose. If it's clear, yellow, green, brown, you name it, all nasal congestion and all mucus is going to be dark first thing in the morning because it's congealed and condensed overnight. But it's more just if it's dark color throughout the day. Other sorts of symptoms, again, facial pain, headache, fatigue, deep cough. I think that's a sign for antibiotics. We typically, by the books, it says for 2 weeks of that. Oftentimes that's a long time to wait before starting antibiotics, but certainly the first sign of a yellow runny nose and a cough is not the time to start antibiotics.
Yeah, it's true. And I think there is a myth out there about the color of snot indicating a need for antibiotics. And old mucus gets oxidized. So the way I explain it to parents is if you peel a banana, at first it looks great, it looks healthy. And then over time it starts to look brown and black even, and it oxidizes. Or if you cut an apple, at first it looks crisp and clean, and then you give it some time and it gets cruddy looking and brown and oxidized. Same idea with mucus is if you've been sleeping overnight, you'll wake up, it's going to be a different color, and that's normal.
I love that. Doctors use food analogies for everything. I love that.
And I love your bigger point that it really has to do with how a child's acting. It doesn't matter the color of the snot. As long as they're eating okay, sleeping okay, they have good energy, they're happy, they're up to their normal mischief. I think as long as they're acting like their normal selves, that brings our worry way down.
Yes, for sure. Yes.
Now I'd love to ask you about normal sleep and what to expect from a child when they're sleeping. And first, I'd like to ask you about snoring. Some doctors have said that snoring is never normal. A child should never snore. And then, as you point out in your book, 85% of kids will snore a little bit, and that's normal and expected. So talk to me about snoring, when to be concerned, when to look at snoring as normal.
So I think a little bit of snoring is okay, certainly nothing to worry about. And what snoring is, it's air turbulence. So there's some sort of tissue that's blocking the airflow. And that could be something as simple as a little bit of mucus, a little bit of congestion, positioning, depth of sleep, a little bit of muscle tone. So a little bit of snoring at all ages, including in infants and newborns, is okay. Nothing to worry about. Things to look for if you have a child who snores is the regularity of their breathing. Do they seem like they're breathing in and out at a regular cadence? Or do they seem like they're little gasps or pauses or arching or discomfort or repositioning? That's something that's a little more concerning. But a little bit of snoring occasionally in a child who's sleeping comfortably, sleeping all night, waking up comfortably, fine during the day, I don't think there's anything to worry about.
When should parents think about sleep apnea?
So sleep apnea is sort of on the spectrum of obstructive sleep disorders, from anywhere from mild snoring to severe obstructive sleep apnea. Kids who have a sleep disorder are usually somewhere in the middle of that range. So apnea, where it's obstructive relative to snoring, means that it's a person who's trying to breathe but can't move air because some sort of obstruction for more than 2 breath cycles. So for a child, that's about 6 seconds where they're not moving air, and that's an apneic event. And a lot of kids have this, and most parents don't even know about it because it's usually in the middle of the night when the parents are sleeping. But if they're having those on regular periods of time where you notice it, where they're gasping and choking and pausing and even waking up briefly without fully waking up, that's a sign that a child can have obstructive sleep apnea, which needs to be addressed. We need to see if there's a physical cause, if there's a physiologic cause, a neurologic cause, of an obstructive cause. That definitely needs to be looked at.
I always ask a parent, and I'm curious what you think about this, but how do they act the next day? Are they always tired, or do they have really good energy? Because my goal is to make sure that the kid is having sound quality sleep. So I think if they're acting tired all the time, I would talk to your pediatrician, talk to an ENT.
Right. And for kids, unlike adults, so we know certainly as doctors and as parents what it's like to be sleep deprived. And if you lose a night's sleep, frankly, we can get by the next day. We're okay. If it happens every day, we can't learn to play violin, we can't play soccer, we can't learn in school, we can't sit still. Kids have not necessarily the same reaction that adults get where we're tired, we just want to take a nap, we want to fall asleep, we can't really have a conversation. Kids oftentimes get tired and wired. And some of the ADHD diagnoses can be related to sleep disorders. I'm not saying that sleep disorders cause ADHD, but certainly if a child has ADHD symptoms, sleep deprivation can lower that threshold. So some of the kids are going to be the kids who fall asleep in the car on the way home from school, but some of the kids are going to be running around the classroom and not sitting still because they're sleep deprived. So any sort of behavioral issue, I think we need to ask about their sleep.
Yeah, it's worth it to get evaluated because there's things you can do. Sometimes I've had kids get their adenoids removed and the parents are thrilled with the improvement in their behavioral symptoms. So tired and wired, I like that expression. It's true. Now, the last thing I want to ask you about is the topic of mouth breathing. There's a lot of parents that are concerned about kids that mouth breathe. Maybe they're sleeping and they mouth breathe, or they never have their mouth closed when they're breathing. Is this something that parents should be concerned about?
So I think the question is for mouth breathing, is it habitual, meaning that they can breathe through their nose, but their mouth just hangs open? And those are oftentimes kids who had mouth breathing for a physical reason. The physical reason was addressed, but they've developed this muscle memory where they just are so used to breathing through their mouth that even when they can breathe through their nose, whether it's while they're awake or while they're asleep, their mouth just hangs open, as opposed to the kids who really just can't breathe through their nose. So for the kids who can't breathe through their nose, I do think it's really important to address why and what we can do to mitigate that. And sometimes it's expansion of the palate because the roof of the mouth is the floor of the nose. So if you open up the palate, you're going to open up the back of the nose a little bit. You're going to open up the soft tissue in the back of the mouth. So I think that's one area. So we talk about bony expansion of the airway, and then we talk about soft tissue expansion of the airway, which could be adenoids, turbinates, maybe tonsils as well. Some of the little kids, the tonsils sit so high in the back of the throat, it actually blocks the nose as well. So I think if there is a physical reason why they're breathing through their mouth, I think that does need to be addressed, depending obviously on their age and the circumstance and how severe. But if it's habitual, I think that's actually harder to manage. I get that question a lot. Should we tape their mouth shut? I have a little fear about that. I don't think obstructing an airway is always wise in a child. Certainly the kids that once we fix their nasal airway, but their mouth is still hanging open, there's certain reminders you can do during the day, almost like a speech therapy or an OT or a PT kind of process, even at home, to remind them to keep their mouth closed while they breathe. But during sleep, sometimes their mouth hangs open a little bit, but they're breathing through their nose, so it's functioning. So that's okay.
My question for you then would be, it sounds like some degree of chronic congestion, having the mouth open, is normal for kids. Maybe just to impart a message to parents, when is that okay and when should parents worry? And mostly to emphasize, when is it okay? Because it's something that I see happen all the time with kids, and they just seem to grow out of it over time.
Yes. So I think if a child is congested, and certainly if it's a young child, like a toddler, someone, the 2 to 5-year-olds who are stuffy all the time, most commonly it's from these colds that are coming and going, more often coming than going, especially during the school year, which is September to June. It's most of the year. So I think that's okay, as long as they're comfortable and thriving and getting good sleep and good energy and eating well. I don't think there's anything really to worry about unless they seem to be uncomfortable. So if they're sounding congested, and a lot of parents come because their child sounds like they have a cold when they don't, and they're not sick, and they just sound so congested, then there can be a physical obstruction or allergies or adenoid enlargement. So I think that needs to be addressed. Certainly not an emergency, but something that needs to be looked at. And it may be that they have everything physically as normal, and that is just something they'll grow out of. And that's where we talk about nasal saline or topical nasal sprays or even some antihistamines, nothing to worry about. I think most of these kids grow out of it as long as it's not to the point of being debilitating or interfering with their development.
It's true. There's so many conditions with kids that aren't really a cause for worry, but there's a lot of things that we can advise to help them feel better.
Yeah, get through it.
So I just want to say, Dr. Shapiro, you're wonderful. Thank you so much for coming on the podcast.
Thank you.
I'm so excited about your book. I'm holding it up right here. There's a lot in the book that we didn't talk about. I loved your advice about how to help keep the air clean, how to think about environmental toxins, thinking about certain illnesses that are common with kids, when to seek medical attention, what to do. So this is really a great book. If you want to learn about anything to do with a child and how they breathe, I highly recommend this book, and I'm really proud of you for doing it.
Thank you. It's a lot of fun.
When's it going to come out?
It's actually available now on Amazon, so you can order it in paperback and hardcover. It's going to land in print sometime late fall, early winter.
And then if people want to see you, where is your practice located, and can they schedule a visit to see you?
They can. I am with a great group called West Side Head and Neck. Our offices are in Santa Monica and Culver City. And I love to see new patients. I love to see follow-up patients. I'm very available. I have a very sort of small, accessible practice, so it's not months and months to get in. I can see your child quite quickly, and we'll take good care.
Thank you for this podcast, and we'll talk soon.
Thanks. That was great.
Thank you for listening, and I hope you enjoyed this week's episode of Your Child is Normal. Also, if you could take a moment and leave a 5-star review wherever it is you listen to podcasts, I would greatly appreciate it. It really makes a difference to help this podcast grow.